Yeah, good evening.
I'm picking on question 45. How can one enhance? Sorry.
Provider, we are waiting for you. Please go ahead. Okay. Doctors, kindly go ahead. Just take 2 questions and then go ahead. Thank you very much. We cannot hear you, doctors. We can't hear you. We cannot hear you, doctors. We cannot hear you. We cannot hear you. Okay, let's move on with Kofi. Kofi, kindly go ahead. Vida, are you there? Can you go ahead?
Yes, please, I'm here.
Go ahead. We are listening.
I'm picking on question 18, which reads, what are the symptoms? Anxiety on its own is a disorder. It's a feeling of nervousness, unease, apprehension on an uncertain situation. And in our daily lives, we all have one form of anxiety in one way or the other. But it becomes a problem of worry. If it persists, the anxiety persists for quite a long time, then it becomes a problem of worry, which needs to be attended to. Signs and symptoms of anxiety includes nervousness, signs and symptoms of anxiety includes nervousness, irritability, sweating, apprehension, unease. And then depression, on the other hand, is a mood disorder which affects one's mental state. Just as anxiety, we also experience a depression once in one's lifetime. But then it becomes a problem just as the anxiety when it persists or when it affects your normal daily life. You are not able to perform whatever function you used to do, whatever work you used to do. You are not able to concentrate and do it because you are depressed. This becomes a problem of worry which needs to be attended to. Signs and symptoms of anxiety, just like of depression, is just like the anxiety. Patient becomes patient becomes nervous, anxious, apprehended, withdrawn, have suicidal ideations, becomes isolated. Yes. So, but then the point of suicidal ideation is very important when dealing with a depressed patient, because having a determined ideation means a patient is planning to kill his or herself. And so dealing with a depressed person, that is one point you have to be looking at. The patient don't have to get to that stage before you start working on. However, if patients show signs and symptoms of suicidal ideation, then your care should focus towards that side.
Okay, okay. So thank you very much. Let's move on to Martha Ado. Kindly take 2 questions and then give us a response. Thank you very much.
Okay, good evening. Please, I hope you can hear me. I want to take question 17. That's how can one maintain his oral hygiene? Please, can you?
Go ahead. Yes, yes. Thank you. Go ahead.
So, we all know oral hygiene is something that is very important because one will not want to walk about with bad odor, mouth odor, as we all know. So, there are a few points one will have to take note of when it comes to maintaining oral hygiene. Aside brushing 2 times, which we all know that it is very important for an individual to brush twice. That's in the morning and in the evening. And a few things that one will have to take note of to maintain a good oral hygiene. The first one is to see your dentist. If you don't have a mouth open, but you want to maintain a good oral hygiene, at least twice annually or at least once a year, you should visit the dentist. It is important to visit the dentist because at least you'll be able, the dentist will be able to conduct an oral examination in you to see how and then have oral or complications. So it is good to see the dentist regularly. Then you have to also stop smoking because smoking also brings about gum disease and then it gives you the smoker's breath. So if you know anybody who smokes, you see that sometimes even if they have not smoked the whole day and they get closer to you, immediately they speak to you, they have this bad breath. So smoking too also brings about challenges with oral hygiene. So if you want to maintain a good oral hygiene, you have to quit smoking. And then you have to drink lots of water. We are saying this, and this is very important because there's something called dryness of the mouth. When your mouth is dry, normally brings about bad breath. So you want to drink more water. And then when you drink more water too, you find out that if there are any food particles or debris that are still in the mouth after eating, it is washed down or it is taken off. So you have to make sure you drink lots of water. Then chewing gum, which is a part that most people don't know. People feel like chewing gum takes away just the breath of the food. But chewing gum also produces more saliva so that you don't have the dryness of the mouth, which will eventually bring about bad breath. So chewing gum makes sure that your mouth, the saliva production in your ongoing of the mouth away from the mouth and in also from your gum and also from your tongue. But you also want to be very particular when you are choosing the kind of gum to take. You're chewing gum, you want to choose a sugar-free because as we all know, as we are growing and aging, we will not want to be having challenges with our health. So if you really want to chew gum to maintain your oral hygiene or to prevent bad breath, then it means that you have to always make sure that your gum, the type of gum you choose, is good gum. So these are a few points that a patient with bad odor or having challenges with oral hygiene will want to take note of when it comes to oral hygiene. Thank you.
Thank you very much. So let's go to Martha Ado. Martha Ado. Thank you, Dorcas. Martha, kindly go ahead.
I just finished my presentation. Or should I go on to another question?
No, Martha Ogo, sorry. Okay, so the network, sorry. The network is very bad. So we'll move to the next person. We have not heard from Vida. Vida, can you move ahead before we go to the next person? Vida, okay, Martha, go ahead. Martha, can you go ahead?
Hello.
Yeah, go ahead. Okay, Martha Ogoy, kindly go ahead. We are listening. Go ahead. We are proceed.
My presentation on oral hygiene. So should I go to the second one?
Please move to the next one because it has been tackled.
Oh, okay. All right. So the next one, I want to answer question 1. That's how to manage blood pressure.
Okay, thank you. Please go ahead.
It means that the person already has been diagnosed of hypertension. And so you, as a nurse or a caregiver, you want to help the patient to lower his or her blood pressure. So first of all, the first thing you want to help the patient is to find out if the patient is blood pressure is being monitored on a daily basis, and even does the patient have a monitoring machine at home? How is the patient monitoring his or her BP? Is it for the monitor blood pressure? That's the first thing you want to know. And if that is not done, you want to find a way that that particular patient's hypertension is monitored daily. Then we all know that the best form of management for a BP patient is to be careful of his or her lifestyle, as the drugs that has been taken. So first, after the BP monitoring, you want to find out the drugs that the patient is taking at home. So you have to go to the drug and then find out from the patient if the patient is comfortable with the drugs he or she is taking. If the patient is having any side effects, you want to look at the side effects and how it is managed. Then the rest will be about a lifestyle. So first, you look at the patient's diet. Is the patient eating a healthy diet, has more fruits, more vegetables? And we know that every patient, hypertensive patient, is supposed to cut down with sodium diet. And so we want to help the patients cut down with a lot of sodium diet. And the best way they can do that is to cook themselves. Because if you are purchasing from patronizing restaurant food or food house, you cannot be able to tell the quantity of salt that is in the meal. So you want to advise or educate the patient to be cooking from home. And that way the patient will be able to regulate his or her sodium diet. Then the next thing is to look at the weight which the patient is. We all know that some of the risk factors for BP or hypertension, obesity. So you want to help the patient manage his or her weight. And by so doing that, you have to look at the BMI of the patient and then educate the patient as such. And then another way you can also help the patient manage his or her weight, aside the diet we have talked about, is to also make sure that the patient is physically active by engaging the aerobics that the patient will be able to accommodate. Because the patient has a high blood pressure, you don't want to trigger it. So you'll be looking at trigger while the patient is exercising. So the exercise or some aerobics at home that the patient can accommodate is what we are looking at. Then if the patient is active, you want to ask the patient to stop. if possible, to cut down on alcohol and smoking, because these are triggers that could influence blood pressure. Then another thing you also want to also look at is to reduce stresses. There are certain things that when a patient does, it brings about stress, a lot of thinking. There are some triggers that will trigger stress in the patient's life. So you want to look at all these things, discuss with the patient, and find a way of taking them out of the or things that could help the patient relieve stress. Or there are some things that when the patient engage in like games, watching television, reading and all that, it would help the patient reduce his or her stress. So stress is also an important factor you also want to look at. Now, insomnia is another risk factor when it comes to blood pressure. So you also want to look at the patient's sleep schedule, especially in the night. So you want to find out how the patient sleeps. Is the patient able to get a good night's sleep? Does the patient sleep well at night? What causes the patient? And then things that will prevent the patient from not sleeping, you want to. So the best thing is discussing such with the patient. You want to look at a sleep schedule for the patient, time to sleep. If the patient is not able to sleep, is the patient on taking any drugs, any food that is preventing the patient to sleep, you want to look at all those things and then take them out. Now, the last point I want to talk about is to get support for the patient, because if, example, the patient has a lot of stresses around, like goes to work, comes back tired, and do a lot of housework, other things, managing a lot of business, the patient is not having enough time to rest, then you also want to get support. So you discuss with the patient, find out if there are any family or friends who could stress can be reduced. So these are a few points can help patients to manage high blood pressure.
All right. So, will you touch one more question before we move on? We'll let the next person will be Christiana, and then we'll get over to George in that order. So let's hear from you. One more question, one more response on one of the questionnaire, and then we'll move to Christiana. Thank you very much. Okay, so let's move to Christiana. Christiana, kindly pick the two questions you want to respond to, and then we'll move to George. Thank you very much.
Hello. I am currently not at a place that is convenient to talk. There's a lot of noise around me.
Okay.
I don't know if you can hear me.
We can hear you. We can hear you.
Hello?
We can hear you. You can briefly share something. We can hear you.
Oh.
Okay, George, kindly proceed with us. George.
Yeah, please.
George Abako, kindly proceed. We are listening.
Okay, please, I just did my presentation during the first meeting.
All right. So just if you can add one more, that's absolutely fine. Martha, do you want to proceed now?
Yes.
Then go ahead. We are listening. Go ahead.
Presenting on prevention of
periods, some of the members are not able to respond properly. Vida, would you want to proceed with one more question and an answer, as well as Eddie? So Eddie, please go ahead. Go ahead. We are listening.
All right. So, say I want to talk to us about how we can improve upon our cardiovascular health.
Absolutely.
So we know our cardiovascular health is basically about our heart and by extension how our blood vessels all communicate to function together. And looking at the word improve, it means that even if there's a normal way of the cardiovascular system working, we can still improve upon it. And according to the American Heart Association, jogging, swimming, and biking, which in a way are aerobic exercises, enables the cardiovascular system to become improved a little and improves upon how the heart is able to contain stress when it's exposed to it or not. So some of the other ways too that we can use to improve our cardiovascular health is through proper ways of eating or balanced diet or dieting. We would have to do away with eating a lot of sugars, which might in a way trigger certain conditions such as diabetes, which can affect our cardiovascular system, especially our blood vessels. Then we may also have to cut down on eating a lot of foods which contain a lot of HDLs, that is bad fat, especially in animal fat, such as beefs and other forms of mammals that we eat. We may have to cut down on those ones. Then we also have to cut down on eating a lot of sodium in our diet. Normally, we may say that we don't eat salt. Some people may say they don't eat salt, but they take medications which contain a lot of salt, and they may have to take particular attention to it. Some of these medications are NSAIDs, which they take unknowingly, which also contain large amounts of sodium sometimes, and also seafoods too. Then we may also have to also eat foods that are rich in vitamin C, which may also enable us to be able to repair our damaged blood vessels. So that in a state where the blood vessels are not in shape to be able to function very well, which ultimately affects our cardiovascular health, we may be able to improve it. But even in all these, before then, you have to be able to go to the hospital for us to get a baseline to be able to maintain. Hello, sir, can you hear me?
Yes, please go ahead.
To be able to ascertain if our cardiovascular health is good or not. So you do have to be able to check our BPs. You have to go to the hospital to check our ECG. You have to do exercise tolerance exams at the hospital. Some hospitals does it. Then we also have to check our cholesterol levels. You have to check to see if we don't have diabetes and all these things. And we also have to realize that we would have to desist from certain life patterns, such as excessive sedentary lifestyles without any form of activity. We have to put a stop to it. Then we would also have to take in a lot of fluids, which is important. Unless you are having a debilitating heart condition, wherein that you are restricted from taking fluid or taking water every day is really, really important for all of us. Then you would also need to take rest when we are tired, because in as much as our heart is continuously working for us, there's very little minimum time for you to rest in between beats. And when we are going to put the heart under so much stress continuously, a time will reach where the heart will be so much tired to continue to work, which will lead the heart into having cardiovascular disease or even arrest, which will not be good for us. So with this one, I think it would enable us to be able to improve upon our cardiovascular health and enhance our well-being as a person. Thank you.
All right. Thank you very much. George Eddie. Sorry for that wonderful thoughts, and we have really learned a lot. Let's move on with Dorcas. Dorcas, would you be able to share one more? That
Okay, please.
Yeah, go ahead.
Okay, so my second question will be based on question 14, which states that what are the early signs of HIV/AIDS and where can I get tested? So we all know that HIV is a virus that weakens our immune system, and it is transferred through bodily fluid like semen, vaginal fluid, and then blood. So quickly, I would like to jump to the early symptoms or signs of HIV/AIDS. So the early signs of HIV, and it's also known as acute retroviral syndromes, which may appear as symptoms similar to those caused by common flu. So some of these symptoms include headache, fever, tiredness or fatigue. The person may also experience joint pains, loss of appetite, swollen lymph nodes. There may be sore throat. There may be rashes which are unpainful. There may be muscle and joint pain. There may be ulcers in the mouth, ulcers on the genital. The person may experience night sweat, diarrhea, malaise, muscle pain, and then nausea. So these early HIV/AIDS symptoms generally develop within 2 to 4 weeks of transmission. Some people may not experience any early symptoms after they have contracted the HIV virus. So for one to be sure, or for one to know that he or she has contracted this virus or have this virus, the person needs to visit any nearby hospital or need to speak to any healthcare professionals. Most people are shy and scared to go to the hospital because of the stigmatization. But this health condition can lead to death and other things. So the best thing the person needs to do is, if the person knows any healthcare provider, the person can quickly contact the person or go to any nearby hospital or any hospital further away from wherever he or she is to get tested. Why? Because some of these signs and symptoms of this early HIV are similar to any different or any other health conditions. Thank you.
Thank you very much. Doctor. That's a very brilliant one. We'll proceed and move on with Martha. Martha, would you be able to pick one more, Martha Ogoe? Yes, Martha, we are listening. Sorry, Martha Adu. Martha Adu, you can proceed. Martha.
Please, can you hear me?
Yes, you have to be very brave because of your network. So we have to be very brave. Go ahead. Martha, just put in your chat what you want to say. Just put it in the chat. We'll read it for you, okay? In the meantime, let's move to one more person. Let's go to Martha Ogoy. Can we hear from you, please? Martha Ogoy, can we hear from you?
Mr. Metal, I've done mine already.
Yeah,
Answered two questions already.
we want you to add one more question. And thank you very much.
It's just a moment. I'm coming.
Okay. Okay, so while we wait for Marta, I want to impress on your mind that we will be having series of this health Zoom meeting presentations, Q&A sessions on our YouTube channel. That is the BHS Health Education Online YouTube channel. And we hope that as we make several ones, we'll be able to let our clients and those we are reaching out, our institutions, companies, friends, to see that we have real professionals who have demonstrated. You watch, you have to see the demonstration, you see the authenticity of how prepared some of you are, and that will help us to be able to get a lot of plans. And so, like I said, from next week, we'll have several presentations from group members who will be assigned to do presentations, or that will be uploaded on our channel. And as we make several ones of them on our channel and people see, they watch, and we share it to our plan, we hope that it's going to make a very substantive plan. I mean, clients will be able to accept this wonderful program. So now let's move ahead. Are you ready now, Martha? We just wanted to conclude, and then we can end.
Okay, so I want to do question 37. How to prevent hypertension? Can I go ahead?
Sure. The floor is yours. Go ahead.
Okay, so the first point is prevent hypertension also has to have a healthy diet plan. So you make sure you are eating healthy. So you know, a healthy diet should consume balanced diet, more vegetables, and then fruits, and then less fat diet, because we know that we have so much fat in our diet. And looking at the pathophysiology of hypertension, it can block the blood vessels and all that, and one can get cancer. So you want to eat less fat diet, more fruits and vegetables. The next thing is you should that one should to keep him or herself at a healthy weight. So you have to know your BMI. Make sure you check your BMI and then your weight regularly. Know when you are going out of, you have to know your normal weight. Find out your BMI, whether it is in the normal weight, and then when you are going out of normal range, be able to tell, because obesity is a sign of high blood pressure, or one is at risk for high blood pressure when is obese. And you have to make sure that you are physically active. And these days, we have very good exercises that we do. One can always do. You can do one in your own room. You can decide to go to the gym. You can decide to do any exercise that you can be able to accommodate. That's to make you fit, prevent you from medication, smoking, and drinking of alcohol, intake of alcohol, smoking.
Okay.
And you have to limit.
Okay, so kindly take note that we have heard what you have shared matter on hypertension. We have heard all the other ones you shared. Due to time, we'll end for tonight, and we hope that you will prepare for next week as we assign others to share specifics on the presentations, on a presentation like this. So thank you very much again for your time. I take note that Bingham Healthcare Services is a legitimate institution. We are pioneering this health education online. You can see all the verifications on LinkedIn group. You can check it out on Google. You can check many other things.